is the return high enough? In public health, unfortunately, it's always about return for the general population, the best benefit for the general population. And in the process, sometimes the individual does get trampled on, but that's public health. Any questions up to this point, or any contributions from anybody? You're also very quiet. Any comments? Fine. So that is the problem. Then I'll go to the second tool that you want to use for problem understanding, and that is flowcharts. These you must be very familiar with. They illustrate where the problems occur. They identify problems to be solved, because as going through the system with the flowchart, you begin to recognize where the bottlenecks probably are. They provide a very good basis for root cause analysis, because they allow you to understand in detail the process and what in that process can influence the problem. There are a number of flowcharts. There's what they call regular or high level. It just shows a basic sequence of tasks with no other detail. There are cross-functionals. Cross-functionals, which I'll show you in a few minutes. They also show who's doing what, which department, what tasks. So they give you more detail. And flowcharts can be on several levels, where you can go down, you look at the resources, you look at the people, you look at the activities. So how do we make a flowchart? The most important thing about a flowchart is to get those who understand the process. If I ask you to make a flowchart of something that happens in the Regional Center for Quality of Healthcare where I work, you'd be totally lost. You'd be guessing, but you're not familiar enough with the institution or its operations to really be able to say, this moves from there to there to there to there, and therefore bottleneck can occur here, can occur here, can occur here. You can't, because you don't understand the institution. So the key of a good flowchart is getting people who understand the institution, who understand the process itself. They are the ones who are able to do flowchart. And you use the usual things, flip charts or whatever you want to use to work out a flowchart. So when you start a flowchart, you must be very clear about who are your internal customers. What do I mean by internal customers? People who work in the system. And who are your external customers? The internal customers are very useful, as I've said already, because they really understand. The external customers can tell you where you're annoying them, where you're blundering, or where you're doing good things. And the output of the customers they receive, in other words, what is it that you do to produce what? So what do you put in the process? What do you do, which is the process? What do you bring out of it? What is it that you offer? That must be understood, otherwise you can't do the flowchart. Identify the main activities, the task, the process, the converting of inputs into outputs, and you can use notes or whatever, which I've been asking for since I came here, but I think we'll just end up using the flip charts, because you're going to do this as an exercise. And then you map the process by moving the notes around, or by discussing your flip chart thing into a realistic picture. Is this really what obtains? For example, you can say, what happens when a TB suspect, a coughing patient, comes to the hospital? Yeah? What happens? In most places, they'll be triaging, yes? They'll be picked out quickly and put somewhere for purposes of infection control, isn't it? Maybe they'll walk from wherever they are put, maybe to be recorded somewhere, or to be clerked somewhere. Their details are taken, they are registered, maybe they're given a card. They'll move from there to see the clinician, or whoever it is who's going to examine them, take their records, and then they'll refer them maybe for lab testing, okay? When the results come out, if it's positive, nowadays if it's positive, you start treatment, isn't it? You guys who are in the business, okay? So you start treatment. So there are a number of steps there. Now, if you are losing patients between, for example, the clinicians and the lab, a flowchart will tell you probably where the problem is going. If patients are leaving before they're even triaged, again, a flowchart will tell you, because it will tell you what happens when a person comes into the thing. So that is why you do flowcharting. It will become clearer as you do it. You can keep the flowcharts as flip charts or on the computer if you like. Okay. So these are the symbols of flowcharting. A rectangle is normally just a step or an activity. The oblique things show the start and end points, and arrow is just a direction. When you don't really understand or it's not clear, you put a cloud. In other words, you're going to come back to it to clarify, okay? And the circle is just a connection, because sometimes the flowchart is so big that you have to go to the next page. So you just circle it to show that it is going to the next page. So this is a basic flowchart, high-level flowchart. It just shows the steps. For example, the circle there could be patient comes. Patient registers, patient sees clinician, patient goes to the lab, patient either put on treatment or whatever, goes home, okay? Just a basic step. That is the most basic of all flowcharts. It just shows you the sequence of things that happen. But when it becomes to get more complicated, you actually include the decision branches. That the diamond is a decision. For example, you can say patient laboratory test positive. If it's yes, refer for treatment. If it is no, maybe you recycle them back to the the general thing. If there's a bottleneck, you say there's a bottleneck here. There's a wait situation where there could be delays. So these are additional symbols. So a real flowchart will look something like that. It will have a start point. It will have steps. It will have decision points. It will have an end point. Okay. And I hope that you'll do one of these today, because you all look very rather tired and very sleepy. So I think if we get you to do some work, you'll wake up. So you'll do one of these very soon, and this thing will be up for you to follow. And then really it's just a question of, once you've done it, you really have to think through it again, reanalyze it, see if there's anything that needs to be sorted out. That is an example. This is for clinic registration of a TB patient. The client arrives. The client goes to a registration clerk. Is the client a first-time user? Yes. Then clerk must open a new record sheet. If they are not, no, clerk pulls out client's records. Once the client is, then the client waits to be called to see the clinician. Or else the client, the new record is made, the new client form is filled out, and again they come and wait at this point. This would be a simple flowchart just for the process of registration. Okay. A flowchart must be sufficiently detailed to make you answer the question, where could something be going wrong? Where could the problem be? Where could be the bottlenecks? What could be going wrong? For example, let's look through this. A client arrives. Say, for example, the clients were complaining about waiting time. Where could the problem be? A client arrives, client goes to registration clerk. And if you're brainstorming, you say, well, what could possibly go wrong at this stage? Now, in our setting, I'm sure my brothers from Ethiopia will agree. In our setting, maybe the registration person is not here, is not there. The patient could be waiting. Okay? They're not there. There's nobody to register them. They sit and sit and sit and sit. When they come and say, oh, what are you coming for? Say, oh, I'm a patient, I came to register. Let me find the notes. So they start looking for the notes. The patient is still waiting. You know what, I've run out of those papers for registering. Can you come back tomorrow? By this time, the patient is really annoyed, okay? Are they likely to come back? Most likely they will find another clinic, okay? That could be your problem, right there. So that is the point of a flowchart. It's meant to help you think through, to think through the possibilities, things that could possibly go wrong. And then you come to here. Finally, if they get past the hurdle of just being meeting the registration clerk, then they say, is this a client first-time user? No. Clerk pulls out client records. What could go wrong there? That usually goes wrong in our clinics. The records are not there, isn't it? I can't find your record. But I came last week. Yes, I know, but I can't find your record. Okay? So what happens? There's a delay there. Because what is going to happen to this poor patient? They're going to be treated like a first-time user. Because they're going to register again. Okay? That is a point of frustration. Then client waits to be called. They could wait forever. Because the person seeing them might have gone all the way to another city to get their salary. So they wait and wait and wait and wait and wait. Those things happen in real life. Okay? So, the point of emphasis is this picture helps you to think through the points at which things could be going wrong. And it helps you with the process of the root cause analysis. Okay? Now, this is what I call the cross-functional flowchart. The cross-functional flowchart, you'll notice, has this bar here, which tells you who is doing what. It has the client. In this case, I'm looking at a visit of family planning, a nurse's aide. It has a nurse midwife and a pharmacy. So these are the areas that you're interested in terms of your problem. So here, you're just saying what each of these are doing across here. For example, client arrives at the clinic, okay? What happens when the client arrives? It goes to the nurse aide who's supposed to greet them and ask, and ask them what they want. And then say, is it the day for family planning? Because some services are given just certain times. If it's yes, they go on. If it's no, then client returns home, okay? So the idea of a cross-functional is to tell you who is doing what to who at what stage. And this is also helpful because again, just like for the other ones, you can see where the potential bottlenecks are. Are we together? Yeah? So a cross-functional flowchart is much more detailed than just the simple flowchart, which just tells you what's happening at different stages. It actually tells you who's doing what and what they're doing to who, so that it gives you a clearer picture. I will not ask you to make a cross-function flowchart, because otherwise, a flowchart, because otherwise we'll be here the whole day and you'll not get to do the routines. Okay, fine. Now it's time for you to work. I've been talking for a good, 40 minutes or so. Now you can relax a little bit. What we're going to do, unfortunately, we've only got flip charts, and this is a lousy room to do group work. How many of us are there?